Good morning.
Hi, Miss.
Okay. So I don't know, even I was there in FHP 8 only. I was thinking why nobody is there. Okay, so we will wait for a few minutes for the others to join. We will finish this hydrotherapy one first, then we will go into our coordination. Okay, so that it is easy, it will be useful for you for your medicine. Okay, I think the others may not come. What happened? Any idea whether they are going to come or not? So we will start, right? So can we start?
Yes, Miss. Just start the class.
Okay. So this is regarding hydrotherapy one. A 16-year-old cross-country runner is referred to the clinic with the diagnosis of right ankle sprain. Design an aerobic exercise program to maintain his aerobic condition while his ankle heals without stressing the ankle in water. So that means like they have asked to, 1 minute. Okay. Hello, are you all there?
Yes, Miss.
Okay. So I'm really fed up with online exams and everything. Daily lot of problems are coming. Okay, we will concentrate. So here in this first case, the person has some problem with the ankle. He has ankle sprain and he has to like it is in the healing process. That means he should not keep his ankle in the floor. Okay, so since it is not healed, we will not be able to give him the weight bearing. Is that clear? So that's why, uh, like here it is given as like without stressing the ankle in water. So what you can here, what we can do is, since we are going to give only aerobic program, we can give them the aerobic exercises uh, in such a way that they should not touch the floor. So that means you can take them little to a deeper water level and give them the buoyancy belt at the waist level or at the ziphisternal level, so that the body is inside water and the feet should not touch the floor. That clear? And they should be they can do any of aerobic exercises. So aerobic exercises means you can do water walking, you can do jogging, you can do swimming. Okay, swimming will be best. Then okay, so you will be able to do only this three, but swimming also, like you need to see to that they are not stretching the ankle. Okay, and in water walking and jogging also, you don't need to make them to do full ankle toe movements. So there should not be any ankle toe movement, but they can just go for just walking with feet flat. Okay, so you don't need to give the full ankle toe movement or the complete uh, gait determinants should not be there. Only the foot flat should be there. Is that clear? So here the point you have to stress is the person should not keep the feet in the in the floor. So he has to be immersed in such a way that the feet is not touching the floor. So you can give a buoyancy belt at the waist level or at the xiphisternal level at some 5 feet or 7 feet of water so that they don't touch the floor. Okay, so this is the first point to note. Then second point is you can give aerobics exercises like water walking, jogging without the ankle toe movement. Okay, without the plantar flexion and dorsiflexion movement of the particular ankle, they can do these two exercises. Is that clear? And regarding the frequency, another thing, you can just follow the land frequency and land frequencies, like in land, how you will design, like how much warm up you will be giving, how much exercise you will be giving, how much cool down you will be giving. All those things you can just follow as per the land exercises. So I hope you have completed the aerobics in aerobics, right? Aerobic class, right? So you can just follow the same frequency in the water. Is that clear? Any doubt in the first question? Any doubt in the first question? So can we go to the next? So here if you see, so here again, this is also a sports person who had an injury in the, who had a cramp in the calf. So here if you see, she was running up a hill and felt a pulling pain in her calf just distal to the knee. Okay, so that is in the calf region, she has a pulling. She decided to run. She has decided to uh, run in a 100K marathon the next day, but have to quit after about 5 kilometers because of the pain. So because of the pain, she is finding, she is quitting the athlete. So the doctor has told her uh, to use crutches and remain 25% weight bearing. So the doctor has told her to use crutches and remain 25% weight bearing for the next 3 days. After that, she can gradually begin to increase the weight she puts through the leg over the next week. The doctor has told Cecily that she should be full weight bearing in week and unable to run in 3 weeks. She is anxious to return to her intensive training session. So past history, she doesn't have any problem. Okay. 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 Past history, she has flat foot and she is using the insole for it. And several times she had the calf pulling before also. That means like regularly she will be having the cramps before also. And Cecily enters the facility ambulating with crutches. She is putting about 25% of weight through her feet. She is able to perform stairs without difficulty. Then in the musculoskeletal, if you see, she has bruises at the medial head of the left gastrocnemius muscle belly. That means she had a fall. Then she is very tender to palpate and has some swelling. So in the gastrocnemius muscle, so that is nothing but your calf muscle. She has pain and she has swelling. The range of and the pain is during rest time it is 1 and during activity it is 10. That means during activity she has a maximum pain range and during rest the pain is very, very less. Her ankle ROM is normal for all motions actively and passively with the exemption of dorsiflexion. So dorsiflexion, the range of motion is less. So it is active only 5 degree and 8 degree. Okay, so the grade, you grade her ankle strength as 5/5 except plantar flexion, which is grading 4/5. This may be limited due to pain. Okay, all the muscles in the lower limb are tight. Okay, so you have to note here all the muscles in the lower limb are tight. So they have prescribed her aquatic exercise, evaluate and treat for left calf strain, gait training, ROM strengthening, progress to land as tolerated. Okay, so the first question is, at what depth of mid-water does Cicely need to do gait training in the water and still remain 25% of weight bearing? So, so as we know that according to the level of buoyancy belt, your weight bearing will be changed, it will be differing. So if you weight bear at the hip level, you will be having around 50% of the weight bearing. Okay, so I'll just take out the slides. If you put the buoyancy belt at the waist level, it should be around 50%. Okay. So here you can see, can you see the slide? Okay. So here you can see.
No, miss.
No. Okay, 1 minute. Can you see now? Okay.
Yes, miss. Can already.
So at the Zephysternal, if you are putting at the ASAS level, that means at the waist level, she will be putting around 50% of the weight, but she has to put only 25%. But if she is putting like keeping the buoyancy belt at the Zephysternal level, that is at the sternal level, then she will be putting 33% of the, she will be weight bearing 33%. Then at the cervical level, when you put, it will be 10%. So you have to put the belt in between the Zephysternal level and the cervical level. So then she will be able to weight bear 25%. Okay. So here, this is just a, like practically it is not possible for you to wear the belt in between the cervical C7 and the Zephysternal level. Okay. So, but just for the theoretical question, you can answer as, you can put the buoyancy belt in between, that is in the middle point between Zephysternum and the C7. So if you put in that between level, you will be weight bearing around, she will be weight bearing around 25%. Okay, so you can just keep this in mind, because you will be getting MCQ questions also with this. So they will be giving person's weight is around 100 kg and he has some fracture in the ankle and he's supposed to weight bear only 50% of the weight. So where you will put the buoyancy belt and how much weight will be passed in the legs, like that. So you need to put, if you want to pass only 50%, you need to put at the ASIS level, and how much weight will be passed through it. If the person is 100 kg, then 50 kgs will be passed through the leg. Is that clear? So these kind of questions you can expect in MCQs. And sometimes like in SEQ, maybe for 1 mark or 2 marks separately, they can ask about this. So you just keep these 3 levels in mind. Is that clear? What happened to everybody today? Nobody wants to answer. Okay, so if you want to answer this kind of questions, better you can unmute yourself and you can answer, because if you are chatting, then I have to open the chat and I have to see. So you can just unmute little bit and just answer and leave it. Okay. Okay, so this is about the first question. Then second question, write a program for deep water to help Cecily maintain her high level of cardiovascular fitness. So this can be same as your previous question. So you need to give any aerobic program for her. Any aerobic program means like you cannot give weight bearing, so you have to put her in such a way that the feet is not touching the floor. So you can take her to the deep waters and you can make her to float at the waist level or at the surface tunnel level without touching the floor. Then you can give water walking and jogging, because like you cannot put more weight in the ankle. So you cannot give treadmill or you cannot give cycling inside the water. So you can only give water walking and jogging. Again, the frequency is same like your aerobic land frequency. Is that clear? So with the same frequency, you can just write the answer for this. So you need to keep in mind, whenever the question is related to aerobics, you need to write the warm-up, then the exercise part, then the cool-down part. So you can write warm-up, what are the warm-up exercises you can give. Then aerobic part, then the cool-down part. So usually warm-up can be any active exercise, any maybe just active exercises, or stretching can be used as a warm-up period, warm-up exercise. Then cool down also you can give active exercises and you can give stretching. Is that clear? So that is about the aerobic program. Frequency alone you take up from Ms. Kavita's slide. I just don't want to confuse yourself. Okay, so you can just follow the aerobics as per Ms. Kavita's slide. Then next question is, what equipment must be useful to assist her with independent stretching in the deep waters for cardiovascular training in the deep water? So what kind of assistance you can give to do this independent stretching? So you can use buoyancy as assistance, one thing. Then you can use floaters. So in floaters you have different types. Like you can, if you want to do stretching for lower limb, then you have something like the floaters will be something like a shoe or a slipper with a large fins kind of thing that you can use. Then you can also use the dumbbells. Okay, so for upper limb you can use the floaters, or you can use the kickboards, all those things. But lower limb you can also use noodles for lower limb. But here in the question, if you see, they have tightness only for the lower limb, flexors, quadriceps and hamstring. So since all are lower limb, then you have to answer only for lower limb. So you can use the assistive devices can be like aquafins. Aquafins will be like a shoe type. It will, you can just wear it like a shoe, and it will be like a fin shape, like a fins. Okay, so whenever you wear it, it will just lift the leg. So that one. Then you can use noodles. Okay. So for lower limb, you will be able to use only this two. That is for stretching. So for cardiovascular training in deep waters, um, so cardiovascular training in deep waters, you can also use your treadmill and cycling. But in that case, you need to make sure the buoyancy level is in between the cervical and the xiphisternum. Okay, so if you put the buoyancy belt in between that, you can still use the treadmill and your bicycle ergometer inside the water. So those two are the devices that can be used to give her cardiovascular training in deep waters. Is that clear? So keep in mind this 25% can be like maybe 50% or 33% or 10% in case when it is coming in the exam. Okay, exactly like your slide. It will not be like this for 25% like that. Is that clear? So even though the question they have many, there is in the case scenario there are many information. The questions they have asked is very simple one. So it is enough if you just answer according to the question. So here, if they have asked you about strengthening, then you can write. You can also talk about plantar flexion. Okay, so plantar flexion is having little lesser muscle power. So you need to talk about strengthening of plantar flexion. But here they have not asked about that. So you can just write about the strengthening alone here. Sorry, stretching alone here. And here they have not asked you to design the program. They are just asking you what are the things you will use to do the exercises. So are you clear? Can we go to the next?
Yes, miss.
So develop an aquatic program for a patient who has chronic low back pain and needs a comprehensive flexibility and strengthening program for legs and trunk. The patient has uh, only one visit approved by the insurance company. However, the patient has a pool in his or her backyard that gradually goes from 3 feet to 7 feet in depth. So 7-foot deep area is only 10 feet long and 5 feet wide. The patient has no other medical problems that would limit his or her performance of aquatic program. So here, this question is little bit generalized, but in exam they will be mentioning you what are the muscles that are weak, okay, and what are the muscles that are tight. So basically the patient has low back pain, so that means whenever the person has low back pain, the spinal extensors muscle will be tight and flexor muscles will be weak. Okay, so that is because of that only they will have low back pain. Okay, so they will have spasm in the lower extensors and they will be having looseness in the abdomen part. Okay, so here when you are talking about the flexibility exercise, you need to see what are the muscles you need to stretch. So then what are the muscles you need to do the strengthening. So as per the question, chronic low back pain, you can come to a conclusion that okay, so for your level you will not be able to conclude. So when they are asking this question for you, they will be clearly mentioning you what are the muscles that are tight and what are the muscles that are strong. Okay, maybe if they are asking this in the final year, then they will not give the muscles. They will just ask the question from this chronic low back pain. They have to get to know what are the muscles tight and what are the muscles weak. Okay, so since it is chronic low back pain, so the lower spinal extensors will be tight. Then all the extensors muscles of the lower limb will be tight. that is hip extensors, knee flexors, that is all the muscles in the posterior aspect of the leg will be tight. So especially the hamstring will be tight, the hip flexors will be weak. Okay, so you have to plan an exercise program for all these muscles. That is, for the spinal extensors you need to um, do strengthening, spinal flexors you need to do stretching. Sorry, spinal extensors you need to do stretching, and spinal flexors you need to do strengthening. That means for the abdominal muscles you need to teach strengthening, and for the back muscles you need to do stretching. Then same thing like that, for hamstring you need to do stretching, and for hip flexors and the quadriceps you need to do strengthening. Is that clear? So you write a program for these muscles. Strengthening you can write, and stretching you can write. Is that clear? So this is how you need to design for this particular patient. So any doubt?
No, miss.
So the next question is, Mike is a 54-year-old man who tore his right medial meniscus playing basketball. He is 2 week status. Okay, just a minute. Let me just read what are the important points alone. Okay, so here also a player who had a problem in his knee, and he has undergone small orthoscopic surgery, and after that he has returned back to his sports. So that means like he will be able to weight bear normally without any problem. So Mike is ambulating without any assistive device. Okay, but he limps slightly because of knee stiffness, and he is able to go upstairs climbing. So all these reveals that he will be able to weight bear completely. Okay, so now from the question, the problem this particular person is having is, first is swelling in the knee joint. Okay, this is first problem. Then he has pain in the knee joint. Okay, apart from that, his range of motion in knee extension is affected. So you can see it is 5 to 100. It's supposed to be 0 to 135 for knee, but his range is affected. That is, both his he has an extension lag of 5 degrees, and he is not able to complete his knee flexion. Okay, sorry, knee flexion. Yeah, he is not able to flex completely, and he is not able to extend completely. So extension is lagging 0 to 5 degrees, and flexion is lagging around 35 degrees. Okay, so he has reduced range of motion in the knee. Muscle power is 4/5 for all the knee and ankle muscles. Okay, so quadriceps, hamstring, gastrocnemius. So all these are knee and ankle muscles. So that muscles are having muscle power 4/5. So very uh, minimal decrease is there. So the person may have tightness, and weakness is little bit lesser. The person may have tightness, that's why he has a drastic reduced range of motion. Okay, so the tightness is there in both flexor and the extensor, both. So you need to stretch the knee flexors and knee extensors, that is gastrocnemius, that is your quadriceps and hamstring. Then you have to strengthen quadriceps, hamstring, and gastrocnemius. Okay. So when you are writing the exercises, the person is allowed to go for weight bearing. That's why they have set 4 feet depth. So normally if it is 5 feet depth, then you can say that they are not allowed to weight bear. So less than 5 feet you are still allowed to weight bear. So here you need to see what are the muscles you are going to strengthen. So for strengthening, you have to write about quadriceps, hamstring, and gastrocnemius, and all should be resisted buoyancy. Okay, so you can use not only resistance and buoyancy, you can also use the floaters and other things to give the resistance, and you can teach them strengthening for these muscles. Then for stretching, you can still stretch hamstring and quadriceps. You can also stretch hip flexors in case like that is leading to the reduced range of motion, but maximum here, since they have not mentioned, you can go with hamstring and quadriceps stretching. Okay, so you have to write about quadriceps and hamstring stretching. Since it is for a sports person, he will be able to maintain his position with normally. So you can do all the exercises with floaters and other things. You can teach self stretching with the floaters and other things. You don't need to give him manual assistance. So that is the first part. Second part, how you will be doing the same thing in the land. That is the second question. Okay, I think land I don't need to explain, right? You will be knowing it already. So you need to write about strengthening of these 3 muscles in the land, how you will be doing. Then stretching stretching for hamstring and quadriceps. So manual stretching for hamstring and quadriceps. Okay. The next part is, as Mike progressed to full ROM and near normal strengthening, how would you use aquatics to replicate the demand of the basketball? So here, uh, what are the movement that is needed in basketball? So that one you have to check. So in basketball, mostly you need to run, you need to jump. I'm talking about lower limb. So these are the 2 movements you need in the basketball, running and jumping. So these 2, they will be doing it. These 2, you have to do these 2 in water. So you can give jogging in single place. Then you can also make them to do jogging in the water. So that is like jumping in the water, then jogging in the water. These 2 exercises you have to give so that it will be replicating them, the demand of the basketball. Okay, then next is cardiovascular fitness. So cardiovascular fitness can be given in floating so that it is easy for them to heal the knee. Okay. Whether you are understanding. Can we go to the next question? The next question is, Jack is a 58-year-old banker with complaints of right shoulder pain that was most noticeable when reaching overhead or behind. That means he has pain when he is doing overhead activity, okay, or behind. Or behind means then his rotation moment is also affected. His pain occasionally wakes him up at night. Jack has a medical history is significant for a non-specific right shoulder injury sustained playing tennis 2 years ago. Okay. The thing is, the particular person is a uh, tennis player. The person had pain while playing tennis 2 years before. After that, it resolved by itself. That means he has not gone for any treatment. So after 2 years, now when he refurbished his wooden boat, refurbished means pushing the wooden boat into the water. Okay, so when he pushed his wooden boat inside water, he had the same pain. Okay, so he had the same pain. So after 2 years, his pain has come back. Uh, so his range of motion is all these things. Demonstrate some aquatic exercise to improve his ROM technique. So here you can do active ROM exercises for all these uh, movements. Then you can also do stretching for all these movements. So stretching, because they have not talked anything about muscle power. So you can go with active ROM exercises that will help you to improve the range of motion. Then you can do self-stretching. Okay, so I think you can just follow the first video I showed you, the shoulder. I think one video I showed you exclusive for shoulder, right? So you can just follow that video, it will give you the answer. So active exercises for abduction, flexion, extension, internal rotation and external rotation. Then stretching for these movements. Okay, so inside water with the knee, with the shoulder, with the cervical level depth, they have to do the movement because the hand has to be inside water. So that means you need to put the buoyancy belt at the cervical level. You can make them to stand in the water and do all the active exercises, then do the self-stretching exercises. Is that clear? I think I have attached one more case. Did I attach one more case scenario book in the LMS? If I have attached book, then you will have answer in this with the pictures. Okay, so I'm trying to actually this movement towards function, Carrie M. Hall. This book is there in the library. I'm searching for the book. They told like somebody has borrowed the book. If I get it on Monday, but I have talked to the particular person. If I get it on Monday, I will ask our admin officer to scan the hydrotherapy pages alone, and I will send you the pictures. It will. This book is very nice for hydrotherapy, but we don't have e-book. That is a problem. Okay, I'll try to scan and I'll send you. So meanwhile, ClassUp, please check whether this particular small additional PDF is attached. If not, then you tell me, I will attach it. Okay, so I have nearly 3 to 4 class things. I will do it by this afternoon. Okay, so I'll do it in the office in the afternoon. So next question is, a person presents right ankle ligament reconstruction surgery. He is on medical leave. Okay, and okay. So that means like here the person is having knee ligament reconstruction surgery. So 1 week before, the person has undergone a reconstructive surgery and the person wants to go back to his normal life as soon as possible. So normally, or autograft reconstructive surgeries, they have a set of protocol. When you come to when you read musculoskeletal and sports, you will understand that. So so that particular person wants to go back to his normal activities as early as possible. So since it is aquatic exercise, you can still go with aquatic exercise because it will not affect his healing much. Okay. Then the problem here is reduced range of motion of the knee and joint effusion. So for joint effusion, if you make the person to stand in water because of the hydrostatic pressure itself, the particular joint effusion will reduce. Okay, so that is a treatment for joint effusion. But you have to write it. You have to say that to reduce joint effusion, you need to make the person to stand in water, and when he is standing in water because of the hydrostatic pressure, the effusion will reduce. Okay. Then decreased ROM. So decreased ROM can be because of two reasons. One is tightness of the muscle and weakness of the muscle. So you have to write, you have two muscles in the knee, hamstring and quadriceps. So you need to write how to stretch those muscles and how to strengthen those muscles. Is that clear? So you have to write. Since the person is normal, you don't need to go with buoyancy assisted and counterbalancing and all. Directly, it's enough if you write about buoyancy resisted. Is that clear? I think I have uploaded this because here in the folder I have changed the name. That means I definitely would have uploaded. Okay, did you see anything, something like that, like this? Right? Did you see this in the LMS? Did you see this book in LMS?
Yes.
Oh, okay. So here you have the answers for this
Yes.
question. You can just see the pictures and read this. You will get idea how to do each exercise. Okay. So you just go through, and if you have any doubt, then we will discuss again. Okay. So do you have any doubt in hydrotherapy now? When is your exam?
On the next Wednesday, Miss.
Okay. So if you have any doubt regarding any other chapter, you just let me know. So can we go to our class, like coordination? You want any break, or we can continue?
I think, Miss, we can have a break.
So 10 minutes.
Okay, Miss. Thank you.
Okay. So yesterday we saw that like Frankel is a person who formulated a set of exercises to improve coordination. And so if you want to improve coordination, you need to make the person to concentrate in their particular movement. Then you need to make sure that you repeat the movement until they accurately or precisely get the particular movement. So repetition, concentration, and precision is the three basic important things that is very much needed for improving coordination. So with this three concept, we will be able to, you can just formulate your own exercises. So these exercises are simple ones which will help you, which will just give you a guidance. Okay. But you can just modify the exercises however you want it. So you can also use the same testing as an exercises, and you can make them to repeat those things, and you will be able to improve their coordination. So that is also is there. Okay. So some of the exercise, so I will just explain one or two. So if you see here, you need to position the patient in half lying, because then only they will be able to observe what they are doing. Is that clear? So you have to position the patient in half lying. Then you can mark in different color pens. So in different color pens, you just put a mark. Then ask the person to flex and bring the leg to that particular mark. Okay, so for example, here you can put A, B, C, D, like that in different colors. Then you can ask, okay, now bring your leg to A, bring your leg to B, bring your leg to C, like that. So first they will be starting with dragging the movement. So they have to just drag the leg on the particular marking you are telling. So once they are able to drag and bring to the exact accurate point, then you can jumble and make it little difficult. That means you are increasing the complexity as the person is able to do the movement. So by jumbling, like you can ask them, okay, now bring to C, bring to A, bring to D, like that. So jumble and ask them to do the movement. So once they are able to perform in this in dragging, then you can ask them to lift and bring it. So dragging is dragging from this point to this point. Okay. Then you can ask them to lift, flex, and bring this point. Lift, flex, and bring to this point, like that. So lift and do it. Is that clear? So this is one way. This is the progression. Then after, when they are able to lift and do it, then you can ask them to perform in the air. So in the air, he has to bring to the particular, exactly over the particular point, okay, without touching the bed. So this is how you just increase the complexity and make it progress. Is that clear? So you can, instead of this color marking, you can keep any objects. You can keep your hand. You can tell them to do it on the hand. Then see here, it is the other way flexion. Okay, so here if you see, the hip and knee both will be flexing. Here when you keep the hand and make them to do, it is flexing the hip alone. Okay, so same thing you can also make them to do for abduction, adduction. Okay, so this is one method in lying. So next is like you can also make them to do in sitting. So you can make them to sit and draw lines. Then you can ask them to bring, okay, bring your right leg to this point. Right leg to 2 here. Right leg heel to heel here. Then right leg toe here, like that. So you can just command them, let them bring the leg on that particular point wherever you are telling them. So when first make it simple, then increase the complexity. Is that clear? So you can make them to, you can draw like this and ask them to perform. You can make them to sit near a wall like this, and then keep the leg on second step, like that also you can do. You can also make them to do this for hands. Okay, so you can also make them to do for hand here. Then you can mark like this and make them to walk on it. Okay, so like the same like that, you can also do it for upper limb. So I will show you some videos which will help you to understand little more easier.
I just came from here. என்னாச்சு சுந்தரிக்கு சொல்லாம வந்தானா என்ன கிடைக்கும்
Okay. So, do you have any doubts? So, I'll show you some more video. Okay, just a minute. Okay, so in this video, there is no physiotherapist assisting. Okay, she is just doing the movement. But actually, for patients, we physiotherapists have to be there to count the speed, to increase the complexity and others. Is that clear? So here in this video, you can just see and get to know what are the exercises they are doing. Just wait. There's few more videos. Okay, so any doubt now? I have sent you two videos. I have sent you two videos. You can just watch. Almost the exercises are same. That's why I didn't display in class. So now I'll give you a few questions. Then you can, I'll divide you into groups. Then you can discuss then we can come back and discuss again the answer. Is that clear? Okay, so there are 5 questions here. Please note down the 5 questions. Now I will divide you into 5 groups. Okay, so I'll divide you into 5 groups. So have you noted down the question? So each group will be taking one question and you will be discussing. So tell me how long you need for this. Anybody? Just tell me how long you need for this. Are you all there or not? Okay, so 30 minutes. Now time is going to be 12. Okay, we will meet by 12:30. Okay, so in between I'll come to the break rooms. Okay, I have opened the rooms. You can join. Okay. So can we have the first group? to present? You can switch on your video and you can also demonstrate.
Hi, Miss.
Yes.
Miss, can I not open my video because my surrounding is...
Okay, no problem. You can just tell us what you have discussed.
Okay, thank you, Miss. So, according to the question, we have to train the coordinate voluntary movements for any two movements of the patient's hip or knee joint. So after our discussion, we finalized that for the first action, we will be doing flex and extend one leg with heel sliding down the table in supine positions
Okay.
by doing the right leg first, then doing the left leg. Then the second movement will be abduct and adduct hip smoothly with knee bend with the heel on the table and also in supine position.
Okay.
That's the two movements that we discussed.
Okay, so you need to tell us how you will be doing that. These are the important points you have to capture in your OSPE. Okay, so position of the stimulator. So position should be in such a way that they are able to watch their movement. Okay, then next is make sure the movement is done within the patient's field of view. Field of view means field of vision. The next is concise explanation and demonstration should be given before the movement is attempted. Then, with full attention, patient is encouraged to complete the task. Then, speed of the movement will be dictated by the student by means of counting and naming the target. Exercise is repeated many times until it is perfect and it is replaced by difficult task also repeated on other side. Okay, so these are the points you have to keep in mind when you are doing it. So these are the points the examiners will be expecting from you. Is that clear? So keep this in your mind. So
Okay,
with
Miss.
this, if you see, first is positioning means you need to position in half lying. Then you can do the movement, do the movement, and you can give them markings. So rather than just doing flexion and extension, so that will be simple sometimes. So if you give a marking, then precisely over the marking they have to stop. Okay, because when you ask them to do just flexion and extension, they will just do the full movement until the bone hits. You will not know whether they are able to do the smooth movement. Okay, so that's why we are giving them the marking. See, I'm not talking to one group, I'm just telling overall class. So why we are giving the markings means when you give the marking, you need to check whether exactly over the point they are able to stop the movement. They should not underride or override. Is that clear? So that is very, very important. So you have to look all these things. So that's why we are giving marking. Okay. So it is correct. So you can just include the marking. That will be more than enough. Then
Okay, thank you, Miss.
next group, shoulder movement.
Hello, Miss.
Yes.
Okay, so we can do because ours is shoulder joints, right? So we can do the position of the simulator can be in sitting or can be in standing or whatever lah. And so the two movements that we'll be doing is the finger to nose test and the drawing on the board, which involves the shoulder.
Okay.
Yeah, so the finger to nose test, the shoulder has to be abducted to 90 degrees and the elbows extended. We bring the tip of the index finger to the tip of his nose. And because the test can also be used as an exercise, so we choose this test. And
Okay.
then for the drawing on the board, we can ask the patient to draw straight lines, circles, zigzag lines or change the minus sign to plus sign. This improves the hand-eye coordination. And this is the Frank Frank
Freckles.
Frankel's exercise. And actually it's a lower extremity exercise, but we can also use it for the upper extremity. And it aims at establishing the voluntary control of movement by the use of any part of sensory mechanism which remains intact, notably sight, sound, touch, to compensate for the loss of kinesthetic sensation.
Okay.
Mhm.
So I just want to add one more point. Like when you say that the coordination, it will be lost if you have any problem in the cerebellum. Okay, cerebellum. I hope everybody knows what is cerebellum. So when you have problem in cerebellum, then only you will be losing this coordination. So the function of cerebellum is it will be collecting the information from the brain. It will be getting the orders from the brain, from the cerebrum. Then it will be correlating with the previous memory plus from other sensors. Other sensors are like your kinesthetic sensation, and not only that, your proprioception sensation. So when a person doesn't have this proprioception sensation and kinesthetic sensation only, they will have all these incoordinated movement. Is that clear? So maybe you will be wondering why there is something called proprioception and all those things. So you will be learning in detail about all these things when you are learning your neuro. So that's why we don't go into that particular aspect. Okay? So
Alright.
here, the brain always will try to compensate for some losses. So for example, if proprioception is lost, then it will be compensating with other. So it will be looking for other type of sensation to just compensate. Is that clear? So that's how a blind person will be able to walk normally. Okay, so a person who has deafness also will be able to walk or do his movement or do his activities independently. Is that clear?
Okay.
Okay. So next
Okay,
group.
Miss.
Hello, Miss. Can you hear me?
Oh, yes, yes.
Okay, for our group is the hip or knee joint in sitting. So for this exercise, we will be doing one leg stretching and straight leg stretching. So for the one leg stretching, ask patient to drag the foot to one point and back, and then progress to lifting, then touch the point without dragging. Then do movement without touching the floor. And then for the straight sitting, bend the trunk forward where the nose is over toes, and then extend the hip, knee, trunk to stand up. That's all from me.
Okay. So any other doubt? So you can also do the ankle, like you can draw the lines for the foot, and you can also make them to touch your heel or toe on that.
Okay, Miss.
Okay. Okay, next group for upper limb test.
Yes, miss. Can you hear me, miss?
Ah, yes.
Miss? Okay. For our group, we are using the finger to nose test. And for first, the therapist and the patient sit opposite to each other, and the patient should be in shoulder abducted 90 degree and elbow extended. And the patient alternately touch the tip of his nose and the tip of the therapist's finger with the index finger. And we can use the metronome to do the counting 1 to 10 by doing 10 times for the consistency speed, and make sure they touch the same place of nose every time. And regarding the movement with grades, for grades 5, we can perform the normal performance, and for grade 4, is able to accomplish and slightly less than normal speed. For grade 3, is able to accomplish activity and movement are slow and awkward and unsteady. And for grade 2, is able only to initiate the activity without completion. And for the grade 1, is no activity can be done. Okay, thank you, Miss.
So last group.
Hello, Miss. Can you hear me?
Yes.
So for my group, we will be doing the lower limb coordination. We choose the foot tapping test, which is the patient will sit on the chair with the knee joints and hip joints flexed approximately 90 degrees. The patient will move the toes up and down repeatedly to tap on the floor as fast and as vigorously as possible for about 10 seconds with the heels planted on the floor. So the test will be performed for both sides separately, and we can count the number of the taps for each side in order to grade their performance. Thank you.
Okay. So overall, like like you may be wondering what is the difference between active movement and this one. So here, if you see, since like we are all normal, we are able to perform it very smoothly. But if you really see a patient, then you will know what is the difficulties they are facing. Okay, so here the main difference between the active movement and our coordination exercises, mainly we look for precise and accuracy. So accuracy means if you ask them to stop in that particular dot, they have to stop. But people who have incoordination problem, they will not be able to stop it, okay, because of the shivering and other things they have. So that this accuracy only we are going to create in them. Is that clear? So that is a difference. Then okay. So anybody have any doubt? Okay. So if no doubts, then okay. So next week you will be having your midsem. Then after that you will be having your break, isn't it? So we will meet you after your Christmas, after the Christmas. So meanwhile, if you have any doubts, you can just WhatsApp me. But I find very less people will be communicating with me regularly. I don't know whether others don't have any doubt or they are not reading or they are hesitant to bring your doubt. So don't be hesitant because this is online learning. If you are hesitant, then you will be affected. So don't be hesitant. You can just WhatsApp whatever doubt you have. Don't think it is silly or anything, nothing like that. So as far as me, you need to be clear. You need to understand the concept and you need to learn it. That's it. Is that clear? So I will send you all the things by today. The problem is the internet only because the students are doing exams and other thing. Even in office also we are not able to get proper internet. So maximum by today afternoon I'll send everything. Okay. And I found 4 people have not joined the break room. Why? Sharon, Lavanya, then another 2 guys. Do you have any reason why you did not join the break room? Alif, Lavanya, Lee Ong, V, Sherin Lu. So if there is no reason, then I will mark absent for 1 hour, last 1 hour, okay? So all 4 of you, if you have any reason, then you get back to me. Otherwise, I will not give you 1 hour attendance. Is that clear? Okay. Thank you. All the best for your exams.